My name is Matt Wall. This is my wife Jayna Wall, and our son Jackson is 2 years old and has been diagnosed with pulmonary hypertension since he was 14 months old.
Jackson had some bumps show up on his face, so I called his doctor's office and they asked us to bring him in just to make sure it wasn't chickenpox or something. So took him in and he saw a different pediatrician, an older pediatrician that day. And the pediatrician checked him out and said everything looked good. He thought the bumps were just bug bites, but he said that he heard a heart murmur. So he wanted to refer us for an echocardiogram. So he said it's probably just, an innocent murmur, nothing to worry too much about, but he wanted to just verify that with the echocardiogram. So we scheduled an echocardiogram for a few weeks later, took him in for the echo. So I was in the room alone, and Jackson was like jumping on the chair or something that was making me laugh. And the doctor walked in, and I looked at his face, and he was just, not even a glimmer in his eye, so I immediately knew something was wrong. His first words were, "It's not a good diagnosis." And then he started talking pulmonary hypertension, and I was just like, "You have to stop, we have to call my husband."
And I got on the phone with Jayna, and I could hear stress in her voice, and she said, "I'm just going to let the doctor tell you." And at that point, he went on to say he suspected Jackson has pulmonary hypertension, which was elevated pressures in the lungs. And before we knew it, we were talking about lung transplant and 5-year survival, and that he likely wouldn't survive the disease.
The following morning, we were admitted to Duke Children's Hospital.
And we were there for 10 days after his diagnosis. The second day we were there, we had his heart cath. He did not respond to oxygen. He did not respond to nitric oxide. And at that point, the cardiologist who was on his case, who was not a PH specialist, said that he would not respond to any treatment and he needed a heart lung transplant.
Matt had come home the night of the echo, and the doctor had told me, "Don't get on the internet, don't do any research." Matt came home and he started doing research. And so he was kind of reading up on it. And I think at that point it was still kind of, we hadn't found PHA yet, so it was still kind of down, dark, what you see on the internet. But then we had kind of, seeing Jackson running around and being happy, and still, even with the IVs in the hospital, being his little trooper self and smiling. We were okay, we were holding it together. And then when they come in and say, "Now we think he'll probably need a heart and lung transplant," that was just like the straw that broke the camel's back. And I just had a complete breakdown, melt in the floor, had to get a wheelchair and stroll me through the hospital. I was that crazy lady screaming, wailing.
She had her meltdown, and about within 10 minutes, she said, "We're not going to stop fighting. We're going to find somebody who's going to help." The doctors that initially diagnosed Jackson were not PH specialists.
Yeah.
And Duke has an amazing adult program. And once the adult PH specialists got involved, they started consulting with the right people.
And the adult specialist at Duke also was very involved, and she's the first one that gave us hope and came in and said, just because he didn't respond to nitric oxide doesn't mean he's not going to respond to medication. So that gave us a lot of hope. And she was very, "We're going to do everything we can. We're going to be here for you. We're going to help you through this."
Diagnosis is not the end, it's the beginning. And through faith and great doctors and great diligence, we can beat this.